You're watching Good Day Austin on Fox 7.
We are back 7:26. There's a newer national health epidemic that's striking Americans, and it's not heart disease or cancer. 35 to 40% of our population have a condition called fatty liver disease, and it can be deadly. Dr. Tsai with Austin Gastroenterology is here with us. Thanks for being here this morning.
Thank you for having me.
All right, so you think fatty liver disease and you automatically jump to somehow alcohol is involved, but you say that's not the case with this.
Now,
what are we looking at?
Now, while alcohol is a major source of liver disease, we're really talking about non-alcoholic fatty liver disease. It's fat in the liver and ultimately the inflammation and damage it can cause to the liver.
And what are some of the causes?
Overwhelmingly, our major causes are obesity, central obesity, diabetes, high cholesterol, specifically bad ratios of good to bad.
And is that why we're seeing an uptick in this as obesity becomes even a bigger problem each and every day? Absolutely.
Even more than an uptick, I would definitely call it an epidemic. Conservatively, 30 to 35% of Americans have fatty liver disease.
And what are some of the symptoms? How do you even know that you might be in this category?
A lot of times patients are quite asymptomatic. They may not have symptoms, but you can have risk factors. Again, high weight, high cholesterol, blood tests that ultimately can be off. And so it's one of those things where it really needs to be on your radar screen to find the risk factors.
And if someone comes into your office, how do you tackle their case of this? Well, how is it treated?
Well, it's definitely a holistic approach in terms of talking about diet, major risk factors, making sure that we're not letting the liver disease progress to scarier things, and specifically irreversibility of scarring and cirrhosis.
And at what point does it become irreversible? Because it can be deadly.
Absolutely. And so that spectrum definitely has different paths, but the biggest risk factor is chronic inflammation. It's that chronic inflammation that can lead to scarring, and while it can take a long time because so many people are affected, that's really the big risk factor.
And what can people do at home to take some of those baby steps, small steps to prevent from even having to face this disease?
When I talk to my patients about this is the tough love part. It's really kind of reinforcing a lot of things that we know, which is, lean proteins, plant-based diet, avoiding obesity, controlling your weight, controlling your sugars, and also speaking with your physician so that you have a good plan in terms of both your blood tests and your surveillance as well. And
that diet is just so closely connected to a lot of what you see.
While we love pills, ultimately the only effective treatment for non-alcoholic fatty liver disease indeed is diet control, exercise, controlling those risk factors.
So maybe if you're at the store this morning, grab a few extra things on the outside of the store.
Avoid the soda.
Yes, that's a big one right there. Dr. Tsai, thanks so much for coming in and talking to us about this. We know there are probably people out there that could stand to make some modifications. We all could there. So
Thank you for having me.
Absolutely. Thanks for your time.